In Florida, an infant stops breathing. In New Jersey, a civilian collapses inside their home. These are the front lines of the modern overdose crisis, where survival is measured in seconds. The danger is not limited to active users. A Florida police officer recently suffered a severe overdose after simply touching a contaminated surface during a routine response call. Tools like OPVEE are the final failsafe in these moments. When housed in public OD rescue boxes, this medication provides an immediate way to reverse an overdose before it becomes a fatality. But even a successful rescue only hits pause on a single emergency. It keeps the survivor alive, but it does not address the pipeline that led to the emergency in the first place. Moving from a reactive stance to a proactive one is the goal of the Rotary Action Group Addiction Prevention. Their Project SMART initiative is designed to move the focus from the rescue to the source. A strategy built solely on the 911 call is a strategy of catch-up. To move beyond reaction, a community has to identify the specific layers, from classrooms to medicine cabinets, where the addiction crisis actually takes root. Rescue boxes fall under the awareness pillar, the A in the SMART framework. To build a full defense, we have to look upstream at the S and M pillars, school and medicine. Teenagers are often quick to dismiss standard anti-drug rhetoric. The Project Smart Kids approach replaces scare tactics with data-driven, honest training to help students navigate the reality of addiction. This bar chart compares long-term addiction rates across different educational models. The data shows that communities using honest, early intervention training see significantly lower addiction rates compared to those relying on traditional punitive messaging. The next layer is environmental. The medicine pillar focuses on the physical availability of drugs, particularly through improper disposal. Research from the Environmental Protection Agency has tracked pharmaceuticals leaching into municipal drinking water. These discarded chemicals create a biological risk that directly affects the health of children in the community. Communities like Grosse Pointe Woods, Michigan, have addressed this by installing safe drug disposal kiosks. These units provide a secure way to remove unused medication from homes before it enters the environment or the hands of a child. By addressing psychological access points in schools and physical access points in the environment, the community begins to sever the crisis pipeline. A successful OPVEE rescue is only the beginning of a survivor's journey. What happens next determines if the rescue leads to long-term stability. This cyclical flowchart illustrates the rehab loop. Traditional recovery often fails because it isolates the patient in a facility, returning them to the same environment where their addiction began, resulting in high relapse rates. The recovery pillar focuses on breaking this cycle. This is paired with the treatment pillar, which emphasizes continuous, integrated care rather than temporary, isolated stays. In Southeast Oklahoma, 15 Rotary clubs provided 24/7 telehealth services to their members. This ensures clinical support is always accessible, even in rural areas, removing the barrier of distance. Sustainability comes from weaving support networks into the fabric of the community, ensuring recovery is an ongoing process rather than a one-time destination. When all 5 pillars are in place, they form a proactive defense that protects the community from multiple angles at once. This matrix shows the pillars working in tandem. Schools provide education, kiosks protect water, rescue boxes raise awareness, and integrated care supports recovery. When one pillar is absent, an opening forms. An unaddressed supply of discarded medication creates a vulnerability the crisis can still exploit. Building this system requires a local, organized force. Rotary clubs across North America are uniquely positioned to implement this model, using their institutional reach to address the crisis at its source. The addiction epidemic is not defeated by a single intervention, but by a cohesive, proactive system. It is time to bring the Project SMART matrix to your local community.